when you're starting, you can't really do everything all at once. But if you start slow and start with something you enjoy and make it fun, it makes it easier for you to continue to do it. You don't have to do the marathon the first day. Like, you can start off with a nice 20 to 15 minute walk and work your way up there.
Hello, everyone. This is Dr. Anita Lwanga. I have my friend Dr. Alicia Shelly here. I'm so excited to have her here on the show. Dr. Shelly and I met through a mastermind group, and I had the pleasure of being on her podcast. And she's one of the people who inspired me to start my podcast and to share my knowledge with the world. But it has been a while. We were just catching up off of camera. But Dr. Shelly has a wealth of information to share with us. She's actually one of the, I think, is it true that one of the first people in the US who started talking about Zepbound?
Maybe not one of the first, but I definitely was a group, the group of people that started talking about it and just sharing more about it. I'm not sure if I was the first, but definitely part of the initial push.
Yeah, because she's actually been on CNN, so and that's probably only one of them. There's probably many other news channels and shows she's been on. I'm so excited to have her here. We're so fortunate that she's willing to talk with us. Dr. Alicia, tell us a little bit more about yourself. From what I recall, you are an internist like me.
Yes.
And then you decided to specialize in obesity medicine, and your journey in medicine and specializing in obesity medicine has taken you on this amazing journey. We're going to ask more questions, but tell us a little bit more about how you made this path for yourself.
Yes. So I was a primary care internal medicine physician. And after 2021, I was like, you know what? I need to do more. I need to be able to get this message out. I'm seeing my patients. I'm able to share with them about their weight, talk to them about their weight, help them to become healthy. But I'm like, more people need to hear this. So in 2021, I started my Back on Track Achieving Healthy Weight Loss podcast, where we focus on trying to help people get to their best health. Like, we realize life is lifing. There's always something that can come up, and sometimes you get off track, but that's okay. You just have to get right back on track. Mm-hmm. And that's been my message, to just share with people, also to let people know that there are multiple factors that drive obesity. So it's not just willpower. And I think people need to hear that to help them stay encouraged and help them to get right back on track and to lead more healthier lives.
Oh, I love that. And is that what inspired the title of your podcast show, reminding people that they just need to get back on track?
Absolutely. Yes. Because I see patients every day. And at this point, sometimes it breaks my heart, because the words that they say, the internalized bias that they are sharing about weight stigma in our culture, in the media, everywhere, it is being promoted that you're having obesity, you're living with obesity because you're not exercising enough or you're not eating the right foods. But in actuality, I don't have a good estimate. But when I talk to my patients, they're like, I eat right, I'm exercising, I'm monitoring all the things, but it's just not working. And that's because there's other factors. There's factors such as certain medical conditions, hypothyroidism, PCOS, certain medications that people get on that causes them to gain weight, like birth control or steroids or just different things like that, anxiety, depression, or even access to healthy foods. Sometimes we live in maybe in an area that may not have a grocery store that we can just drive 2 minutes away. We have to drive 30 minutes, 45 minutes to get someplace, or is it safe where I live? So there are many different factors that drive it. And my goal is to share that with people so that they do not have that internalized bias and they're able to kind of move away from that and just start living their healthy life as well.
Oh, that is so awesome. And I think a lot of us as physicians who interact with many patients, primary care or not, even specialists, I think that's a question that patients I'm finding, I think, more brave, because I think it takes a lot of courage and vulnerability to ask your doctor and be like, hey, what else do you think I can do for my weight? I'm struggling with my weight. I'm finding a lot of people want to have the conversation. And once we start asking questions, we're like, yeah, like a lot of people, some are not even eating enough. I'm like, what do you mean you're only eating this many calories? And so the math does not math. So I love the fact that you point out it's other variables. It's not just the amount of exercising XYZ times and doing this crazy HIIT workout or eating XYZ. There's other variables. You mentioned or alluded to medical conditions. So you mentioned hypothyroidism, PCOS. Are there any other medical conditions that may make it more difficult for somebody to lose weight?
Oh, absolutely. The other thing I forgot was genetics. So there's some people who have a genetic abnormality like Prader-Willi syndrome, where basically they always feel hungry. they do not feel full, and it leads them to wanting just eating. And those individuals tend to have some also learning disabilities as well. And so that can also, it impacts them because they're not able to really live productive lives because of the fact that they're always feeling hungry. And then they have also that learning disability as well. And so I actually have one patient who has that, and it's so hard for them to really lose weight because they're always so hungry. Also, I forgot to mention aging. As we get older, our metabolism starts to decrease. And not only our metabolism starts to decrease, but then also sometimes our hunger hormone can increase as well as we age. And that can lead to people gaining weight. So if you remember when you were in your early 20s, early teens, you could just stop eating pizza, you can go exercise, and you lose 10 pounds like that. But now, fast forward, I'm in my 30s, I'm in my 40s, and you're like, dang it, I have to do more. A lot of that is because of the metabolism decreasing as well as we age, and that is normal. And so I do find sometimes as women also enter into that perimenopausal, menopausal rate, that there is some fluctuation in hormones. So people who have like insulin resistance, where basically their body's producing so much insulin, it's leading to them depositing more fat. And so that too is a condition where people can tend to gain weight without necessarily losing it. So there are so many different other conditions out there that can affect people and drive obesity and make it for people to lose weight and to maintain their weight.
Yeah. Thank you for explaining that. And you also mentioned insulin resistance. Some people who have diabetes mentioned that once they started taking insulin, their weight went up. Is this true?
Oh, absolutely. The reason being is that because their body's having so much higher insulin, yes, it's bringing down their blood sugar, which is what you want it to do. But that insulin hormone also triggers the fat to want to store instead of it to be burnt. So that's why people tend to gain weight with it or find it hard for them to lose weight.
Besides insulin, are there any other medications that somebody might think about or look at or ask their doctor to change that could be causing them to gain weight? I think, you did mention insulin. You mentioned oral contraceptive pills. What else should patients be looking out for?
Yeah, so there are even some such as certain depression medications like Paxil that can cause you to gain weight. Gabapentin can also cause to gain weight. For nerve pain, so it's hard. There's not as many, but sometimes that can also lead to some weight gain as well. Other things that are on that list, I forgot to mention, for certain antipsychotics, so for people who may have like bipolar or schizophrenia, such as aripiprazole or Abilify, the risperidone or an olanzapine. I'm sorry, I'm forgetting their brand names.
Oh, the generic is fantastic. Yeah. At least across countries that can find the Google.
Okay, all right. I'm sorry. I was like, for a minute there, I'm just like saying the generic name and I'm forgetting the brand name. So I apologize for that.
It's perfect. It's perfect.
But those medications can also lead to weight gain as well. And so sometimes my patients who need to be on these medications to control their mood, that is one of the things that they're finding too. Forget about Provera or medroxyprogesterone. And that particular medication, that can definitely cause young women to gain weight. So it's very common for me to hear people saying, hey, I got the Depo shot and I gained 30 pounds. It's just because it just stays in your system for so long. And then steroids. Sometimes we have to be on steroids if you have lupus or rheumatoid arthritis. Like for continuous, the steroids can also promote some weight gain.
Yeah, thank you for listing all of these medications. So if somebody feels like their medication has caused them to gain weight, what should they do? Should they just stop the medication? Should they approach their doctor or their specialist to ask to switch to another medication? Should they just start taking Ozempic or a similar medication? What would you suggest that they do first?
Yeah, I said the first thing is have that conversation with your doctor so that they can be able to make sure they know which medications they should put you back or switch you to. So it's important that you speak to your doctor, make sure that you guys are on the same page. I would not stop the medication cold turkey. Like medications such as the antipsychotics, those can actually lead to worsening mood episodes. So if you were to stop them cold turkey, so it's important that you talk with your doctor to make sure they put you on a different medication that won't be weight promoting. The other thing I would say is I would definitely recommend if your doctor is very versed in obesity medicine, then definitely ask them for other alternatives. But you may need to see an obesity medicine specialist who can be able to recommend certain medications. Because for my patients who can't necessarily get off of those medications, we've tried different ones to help block that weight promoting option. So it's important that you maybe see that specialist if you're in that predicament.
Okay, thank you. That's excellent advice. Yes, I think it's very important to make sure you're doing things appropriately in terms of switching medications. Now, going back to maybe some of the basic things. If somebody wants to lose weight, they're not really sure where to start, just adjusting their lifestyle. Say they've never tried to lose weight, or maybe they've tried different fad diets or different diets. Is there a specific diet you think is more effective that people should implement? Maybe that's a very basic place to start.
Oh, absolutely. And we always are trying to make our diets better for sure. So the one thing I would recommend, so when it comes to that dietary pattern, it's important that number one, you find a dietary approach or dietary pattern that works for you, meaning one that you're willing to eat. If you hate vegetables, you're not going to do a plant-based diet. You may eat a little vegetables here and there, but you're not going to be completely plant-based because you just don't like that. If you're somebody who has a medical condition such as high cholesterol or hypertension, you may focus more on that DASH diet where it's a low sodium diet, you're eating less salt, but you're having a higher quality of fruits and vegetables to help supplement that as well. Also, for the high cholesterol diet, the Mediterranean diet or heart healthy diet can be helpful, where you're eating foods that are lean meats, those lean red meats, but you're focusing on your fish, your seafood, your chicken, also still having increased vegetables, fruit and vegetables, as well as like olive oil and things of that nature. So depending on your medical conditions are going to be key. And then our cultural preferences too. We all have that experience. We all grew up a certain way. And it's hard for me to tell people you can't eat rice because you have type 2 diabetes. But it's easier for me to say, hey, I know you enjoy rice. This is something you grew up with. This is a comfort food for you. What do you think if we maybe switch to cauliflower rice, or we minimize how much rice you do eat on a weekly basis? So finding that compromise is going to be important. When we look at all the different studies of diets, what we find is that if somebody can stick with it, it's most likely going to help them with losing weight. Like they all lose weight. It's just which one can the person stick to? And so it's going to be important to find that balance as well. If you're taking medications such as a GLP-1, Ozempic, Mounjaro, Wegovy, Zepbound for your weight or for maybe type 2 diabetes, it's going to be important to make sure you're getting enough protein because those particular medications in general, they actually curb your appetite and they allow you don't feel as hungry. And when you eat, you feel full, but you're not getting the nutrients you need and you're losing out on that protein. So it's important to maybe have more of a higher protein diet in that case. And then if you do have type 2 diabetes, the goal would be to have either a low glycemic or a low carbohydrate diet. So you're eating foods that aren't shooting up your sugar. So you're focusing on foods that are a little bit more balanced, complex carbs if you are eating them, but making sure also you're getting your protein. So to answer your question, there's not just one particular diet that is helpful, but it also depends on your medical conditions, your individual preferences, and your cultural preferences.
That's good. And I think that's so practical. As you mentioned, people have their cultural preferences, foods that they are not going to eat. If culturally you're vegan or vegetarian, or just things that you're used to. So I think that's very practical. Thank you for sharing that. And going back to the basics, exercise. Is there a specific exercise program that you'd recommend that somebody utilize to help them lose weight? Because there's so much we're hearing about. Some people are saying their trainers are telling them lift weights only right now while you're trying to lose weight. Some are saying, oh no, my trainer told me don't lift weights, do cardio only. What do you?
So in my opinion, I think you do need a balance. So when we look at the recommendations on where people have been able to lose weight, they recommend for general health benefit that people exercise for 150 minutes per week with 2 days of strength training. Now, it does not tell us what type of exercise to do. And so that's where people get a little bit discouraged because in their mind, they think, oh, I have to go to the gym all the time. They don't. If you're somebody that enjoys being outdoors, you can go walking, you can ride your bike, you can do other things that kind of give you that 150 minutes per week, but then make sure you do the strength training. And the strength training does not mean going to the gym and lifting 150 pounds. No, actually, it can be, you can do like different hand weights at home. You can do cans, jugs of water you can lift. You can actually do resistance bands, Pilates, which even though people is stretching, but you're holding that particular pose for a a long time, which causes that muscle to contract. So there are other ways that you can find to stay active. But the most important, I think it has to be something that you're willing to do and willing that you enjoy. A couple of suggestions or strategies that I recommend: finding something that you enjoy doing. You may not know what it is to start, but try different things, whether it's going for a walk or taking an exercise class or going on YouTube and just Googling chair exercises. Like, you can do different things that allow you to get your heart rate up. Also, I would recommend starting slow with it and working your way up. You don't have to do the marathon the first day. Like, you can start off with a nice 20 to 15 minute walk and work your way up there. I know some of my patients, they sometimes have the mindset that they have to do everything all at once or nothing at all. But that's not the case, because first of all, you get discouraged because when you're starting, you can't really do everything all at once. But if you start slow and start with something you enjoy and make it fun, it makes it easier for you to continue to do it. Because the one thing I'll say about weight loss, it's about consistency and staying consistent.
And I love how you also point out it should be something you enjoy. Same with the diet. It should be sustainable. It should be something you can continue eating for the rest of your life, because whatever we do today, the results happen tomorrow. So it's not like we can eat this way, lose the weight, and then go back to what we did before, because then we'll go back to the weight before. And same with the exercise. If we do this intensive exercise program that is not sustainable and not practical, we quit. Then things are going to go back to what they were like before. So thank you for sharing that. And going also back to the basics, I don't know if we're going to have time to talk about medications. I think we're going to have you back in the future to talk more about weight loss medications. But mindset, you talk a lot about mindset. What role does mindset help or play and help us losing weight?
Oh, yeah. So mindset is important because it helps us, it tells us whether to keep going with our weight loss journey, or it can hinder us and discourage us. And everyone's different. We all have our different personalities. I tell my patients, you are the expert of you. So you tell me what works for you. But some of the different personalities that I see is that you sometimes have this person who is all or nothing, where it has to be this perfect, where I go to exercise 2 hours a day, I eat 3 meals a day, and if I don't do this, then, oh gosh, I'm not gonna lose weight, and therefore I will not do anything at all. And for that particular personality, it's important for us to, first of all, have a little grace, because they usually have a lot going on. Remind them that definitely Rome was not built in a year. So you can start slow with your progression and kind of work your way up. I have some people, as far as personalities, where if they don't see themselves losing weight, then the motivation teeters out. And for that individual, I'd recommend focusing on more healthy interventions, like finding something that you're trying to improve in your health. Like, for example, if I have high blood pressure, I'm trying to exercise so that I can get off my medication so that my blood pressure can be controlled. Focusing on other things that are not necessarily weight. Because guess what? If you start to tone a little bit more as you're doing your lifestyle, you may find that your weight goes up a little bit because your muscles are toning, and muscle weighs more than fat. And so if you're getting discouraged because the scale is going up a little bit, but your clothes feel loose, it may be that there's a difference in your body composition. By just focusing on the scale alone, it will discourage you. But if you focus on other areas of feeling more energy, clothes feeling loose, or other areas that are showing that you're improving, that helps the motivation to continue.
That is good. That is very good. And I want to squeeze in one more question before we wrap it up. But accountability, you talk about accountability. What role do you think accountability plays in helping us lose weight and maintain the weight that we've lost?
I think it is a huge role, because sometimes everyone's different on what works better for them, but having that person who you're being accountable to, whether it's a friend or family member, or even if it's going to your doctor on a regular basis, it helps you to keep moving forward because you have a deadline. I'm a chronic procrastinator. Like, I procrastinate all the time. So I need to have a deadline that I know that, hey, this is coming up, so I need to hurry. I need to do exactly what I need to do. I do this all the time when it comes to going to the dentist. I make sure as I get closer, I'm flossing my teeth more. I'm making sure I'm doing the things that they're telling me to do. So when I go see them, it's perfect.
Yeah.
And so sometimes with your weight journey, there may be certain health goals or health habits you're trying to incorporate by having that person who you're checking in with. You want to pick somebody who's not going to judge you or make you feel judged, but somebody who can help you with staying encouraged and keeping you going and keeping you motivated, which is accountability is important. You can get, whether it's a family member or friend, you can even pay like a trainer to be your accountability partner. You can go to your doctor, or you can go to a Facebook group where people can help you stay accountable. I know for me, doing my trainer, I pay to go see her 3 days a week. I know I'm there. Everything else is gravy. So it just is good to have that accountability.
I like that. And we're going to end on the accountability note. If somebody wants to work with you, how can they get a hold of you?
Oh, absolutely. If you'd love to work with me, please check me out on my podcast, the Back on Track Achieving Healthy Weight Loss podcast. You can also find me on Instagram, YouTube, and LinkedIn and Facebook. And you can just look for my handle at Dr. Shelly MD. And if you're in the Atlanta area, I am actually seeing patients for obesity medicine full time to help them with their weight at the WellStar Centers of Best Health in Douglasville, Georgia.
Awesome. We'll make sure to put all your social media handles and your website below so that people can connect with you. And thank you so much for taking the time out of your schedule to talk with us. I am going to have you back. I have too many questions about all these weight loss medications, which ones work, which ones don't work, side effects. I have patients who are taking these medications, so I'm so sure they would love to hear from you and hear about what's also coming down the pipeline. So we will make arrangements to have you back.
Well, I'm looking forward to it because there are some good ones coming down the pipeline, so we'll be able to talk about it.
Okay. We're going to make it a date and we will have you back. But thank you again for being on our show. Bye-bye for now.